So the next presentation will be given by Ana Gámez-Valero. She is from the Department of Biomedicine at the Institute of Neuroscience at the University of Barcelona in Spain, and she's a postdoc. And she will give data on plasma extracellular small RNAs are early deregulated in Huntington's disease and correlate with cognitive symptoms. Ana, it's your stage.
Good morning, everyone. So first of all, thank you to the organization for inviting me to explain our work in small RNAs as biomarker for HD. So as we have seen in the previous talk, in the previous session, we don't have still a disease-modifying treatment for Huntington disease, and although several and many clinical trials and new drugs are being developed, many of them do not show all the expected good results that we would like to. So we can think about several reasons, but two main reasons for that is that many of these trials and drugs, clinical trials, only include patients in a very late stage of the disease, and do not include the pre-manifest patient that we already know that they suffer brain changes and cognitive decline. Moreover, maybe these drugs could be working, but we are not able to assess their benefits because we don't have the proper biomarkers. So for this reason, it's of paramount importance to define a measurable and a specific early biomarker that could be a progression marker, not only to diagnose, but also to study the disease course. In this scenario, we propose the use of plasma biomarkers as a minimally invasive source. And specifically, we focus on the study of small RNAs in two different plasma subfractions. Why? First of all, RNA, because in many neurodegenerative diseases, including Huntington disease, transcriptional changes occur in very early stages of the disease. And the analysis of two different plasma subfractions, the one enriched in exosome and microvesicles, extracellular vesicles in the ensemble, and the non-EV, could allow us to detect more specific and sensitive changes of molecular changes that could be masked by the analysis of the total plasma sample or the whole blood. So hence, here we analyze the RNA content of three different groups from the enrolled HD cohort, and we observed, following the MICEP guidelines, that they don't seem to have any differences in particle concentration, EV markers, or size and morphology of EVs. By next generation sequencing, we deciphered the content, and we observed a huge variety of small RNA biotypes. By differential expression analysis, we observed that most of these species were downregulating in Huntington disease, with many changes occurring already at pre-manifest stages. From the whole ensemble of RNAs, only microRNAs only accounted for 2% of the regulated molecules. Altogether, these small RNAs, the regulated, could discriminate between groups, as shown here by PCA analysis. So at this point, we ask ourselves if this deregulation that seems to be progressive with the disease could be correlated to somehow with the parameters that are studied across the course of the disease. So we group the parameters as cognitive feature and motor parameters, and from all the correlation performed, only one was statistically significant, and was the one who accounted the whole ensemble of small RNA deregulated only in pre-manifest patients and the cognitive features, the Stroop word and the symbol digit test. We wanted to go into detail in this correlation, and we performed a regression analysis to see which of these two cognitive tests could be the one really related to this deregulation in small RNAs. As shown here, the small RNA deregulation is related, really related, to the Stroop word performance of patients, not in a very good way, and in the symbol digit not as so good. So in order to see or to assess if this correlation is mainly due to the disease effect of some randomized effect of population diversity, we included in the same analysis 4 control individuals that we test similarly. We observed that this correlation, both in the regression and correlation analysis, decreased. So in clinics, it is important to know how molecular biomarkers could be implemented. So from 5 small RNAs that we could select, we are happy because we validated 4 of them, showing that our pipeline works as progression biomarker, maybe, or early biomarker from prodromal to pre-manifested stages. So, but which can be the added value of these small RNAs as biomarkers in this current HD situation? So we compared the performance of diagnostic performance of neurofilament as the most used blood biomarker in neurodegenerative diseases in our groups. These are the same samples that were validated for PCR. And we compared this performance with the performance of the whole 4 small RNA biosignature. We already see an amelioration of this ROC curve in the case of small RNAs. And this is even better when we use all together. So at this point, it's obvious to ask for what is happening or what will happen in early stage of the disease if we look for analyze the expression of these small RNAs in even earlier stage of the disease. So finally, I just wanted to sum up, saying that a small RNA profile in plasma may define novel biosignature for the early stage of the disease and might help to identify early affected individuals and better stratify patients in future clinical trials. So I would like to thank my group, especially Marina Herrero, who is the PhD student helping me with the work of this project, and all the whole clinic group from St. Paul Hospital, and of course the HDSA for the funding of this project.
I think we have time for a quick question. So, hurry up. Yes?
Thank you. Herwig Lange from Düsseldorf. I think there's a fundamental misconception about the prodromal stage. You showed in the diagram they have functional decline, they have non-motor symptoms. This is definitely a manifest part of the disease.
Yes, we know, and because of that, we would like to go even earlier to see how the expression of these small RNAs are modified or not. I don't know if I answered your question.
I think can you save the question for?
Yes, please.
Sure. Super, because I think we have to move on. Thank you very much, Anna.